Have you been told you have scoliosis? Are you worried? You are not alone. Scoliosis is very common. It occurs in 3% of the general population. It happens more commonly in girls, and severe curves are more common in girls. I am Dr. Sanjay Sarup. I am children's orthopedic and spine specialist and an expert in scoliosis. I will talk to you a little bit about what is scoliosis today. What is scoliosis? Scoliosis is a lateral bending of the spine. You see, in a normal spine, when we look at it from the front, the spine looks quite straight. However, in some children, it grows sideways and assumes a C shape or an S shape. You can see the S shape even on this model here. I have made it like that for you. And this is called scoliosis. Also, what happens is, as it deviates laterally, it rotates. These vertebral segments, they will rotate. The ribs get lifted up and it causes a hump, a deformity of the back. This deformity becomes most visible when a child bends forward and it becomes revealed. And this is one of the diagnostic features of scoliosis. You may also notice other things like asymmetry of the shoulders, asymmetry of the waist, a chest deformity. So what causes scoliosis? In most cases, more than 95% cases, we do not know what causes scoliosis, and therefore, very conveniently, we label it as idiopathic, means I do not know what this is. In some cases, there is an abnormal development of the vertebral segments or the ribs, and therefore, there is a growth disorder. This is called congenital scoliosis. Scoliosis is also associated with some genetic problems and also associated with neurological issues. We doctors have a way to measure scoliosis, and we measure scoliosis by something called a Cobb's angle. It tells us what the severity is. A small angle means a small curve, a large angle means a large curve. Scoliosis has a tendency to increase with growth. You can see it on the example here. There is a 4-year-old child. She saw an orthopedic surgeon. She was suggested treatment. She did not take the treatment. She saw me again at age 13 with a very severe curve. So this tells you that as a child grows, the scoliosis will grow. Usually we know that curves which are less than 30 degrees will not increase after growth has completed. But curves that are more than 40 degrees will increase slowly even after growth is complete. And this forms the basis of our conservative treatment. So why should we treat scoliosis? Scoliosis is considered to be a major public health problem. There are long-term health problems which occur in children or who become adults with scoliosis. For instance, breathing becomes a problem. So the lung function is not very good in people who have long-term scoliosis. Cardiac function is affected. Digestive system is affected. The spine, because it is curved, it is eccentrically loaded, and therefore they get arthritis prematurely of the spine, and therefore they live with a lot of back pain later on. So the most important thing to remember is scoliosis curve increases over a period of time, and it causes major health problems later in life. Other important facts to remember are that scoliosis is very common. It increases in magnitude over a period of time as the child grows. Early detection is very important, and early proper treatment is very important. Most children who attend our clinic are treated conservatively with exercises and bracing. However, children whose curve exceeds 40 degrees are treated with surgery. Having scoliosis is not a disaster. Scoliosis does not stop you from playing games, taking part in athletics, or any other activity that you want. Properly treated, a scoliosis patient will lead a normal life. In subsequent videos, we will talk about various treatment modalities for this condition. Thank you.